Pushing through pain can either make you stronger or seriously set you back. And most people don't know the difference. In the gym, one of the most common phrases that we hear is no pain, no gain. So, as a physical therapist, one of the things that I try to instill in a lot of my patients is just being able to recognize good pain versus bad pain because both exist. In terms of bad pain, what that's going to really relate to is if you're having sharp pain, very dull, achy pain, or pain that isn't associated specifically with that general muscle soreness that you get after a hard or a good workout. Now, if you're just pushing through the pain that kind of makes you grimace in terms of it's very sharp. So, for example, one of the pains that people will have that I'll see from the gym is if they're working on some kind of bench press and they notice as they're pressing and especially as they're loading and bringing the bar down, they get pinching or sharp pain on the front or the anterior side of their shoulder when they're doing bench press, right? So that type of pain can be related to long head biceps tendonitis, can be impingement of some of the structures of the shoulder, can be issues with some of the rotator cuff muscles when you're loading or especially doing heavy presses. Now, diagnosis wise, that's why we get into a lot of like the special tests to see what structure is possibly affected. But that's a pain that you definitely don't want to just continue doing the movement, continue doing the exercise. So, for example, I've had a patient who they had the same thing where they're working on bench press, they get front of the shoulder pain, especially as they increase their weight. But because they were on a specific training program, whether that was designed by a coach or by themselves, they had a specific number regarding the number of sets, number of reps, and the specific weights that they were using that they wanted to hit and achieve regardless of the pain, right? They're like, oh, at this week, I need to be doing this specific number. And they, even though they had the pain, it wasn't excruciating or high enough pain levels that it would stop them. It was just enough to be uncomfortable, but they described it as a sharp pain. However, whenever you push through that type of pain, what tended to happen, especially if you just persist for months at a time and you increase weight, now you could be potentially putting some of these tendons, some of these muscles and soft tissues at risk of getting damaged and injured. You can end up with strain or tears in these structures if you just continue to persist, right? Because then that type of pain is your body telling you that there is too much of an overload on these structures, or there's too much compression or wear and tear on those tendons, on those muscles, and it's letting your brain know that, hey, there's some inflammation, which is indicating that there may be some tissue damage from doing this movement. Could be you're doing it incorrectly. Could be the load is just too significant for those structures at this time. Or you increase maybe your volume in too short of a time for your muscles or for the other structures to adapt to the type of training volume that you're trying to participate in, right? So that type of pain is one that you want to address and address early, right? So for example, what that would look like is if you're taking that bench press example is one, decreasing the load and starting off with the bar and making sure the mechanics are consistent, correct in terms of positioning and your posture. As you increase the weight gradually, right? Because a lot of times what can happen is maybe as you increase the weight, you lose a little bit of the form. That's just going to happen naturally as you increase weight. You lose a little bit of the form. So making sure that you're not going so excessively high in terms of the load that you lose a lot of your proper positioning and your proper mechanics. Now, your goal, especially when you're talking about strength training, is you want good mechanics, good proper positioning and posture while you're doing whichever lifts that you're working on. And just knowing that as you increase, your form isn't going to be 100% perfect. But if you're starting to lose your form completely as you get especially closer to like a 1 rep max, so the most weight that you can move, then maybe that weight is a little bit too much for you, because if you lose your form completely, that's just excessive, and that's just asking for a different type of injury, whether that be injury to the tissues, to the muscles, to the tendons, or anything else, right? Especially if you possibly drop the load because the load is too excessive, right? Now, the pain that you can push through in terms of, okay, if you're working on increasing your reps, increasing your weight or the load that you're moving and working on, is that typical muscle soreness. So for example, if you're working on strengthening like your bicep muscle and you feel that muscle engage, you feel it getting fatigued, you feel it getting sore, it's like, okay, you can continue to do more reps, more load as, in terms of form and maintaining proper positioning. Whenever you're doing like a single joint movement, like a bicep curl, so it's just your elbow, flexing and straightening or extending, that's a little bit less risky compared to if you're doing like a bench press, so it's a compound movement. So form isn't the most important because it's very hard to do a bicep curl wrong, right? But that type of pain where it's not exactly pain, it's more muscle soreness. For someone who has experience in the gym and they're familiar with that, that's the type of discomfort or feeling that I would say, you can push through that as long as you're managing the weight how you want, in terms of it's not just very reckless. You're not just throwing the weight around, you're controlling it to some extent. Then you can push through that. Or even if, let's say, you go into the gym and you notice, oh, my hamstrings are sore from the previous leg workout, and you're wondering if it's safe to work out. Yes, it is safe to work out while you're sore. It's just you're going to have an adequate warm-up, making sure you're preparing your body in terms of mobility, in terms of making sure everything is warmed up prior to doing another workout or exercise for that same muscle group that is sore. But it's okay to train while you're sore as long as you're being careful with it. But that's the type of discomfort or feeling that you can push through, right? But as long as you're being smart about it. But if you're having very sharp pains that almost limit how much you can do in terms of weight, that's what you want to work on, bringing either the load or the frequency down. Or if it's irritable enough, then taking rest or rest days to where you're allowing the inflammation to calm down. Maybe you're working on other things where you're icing or using other modalities to bring down some of the swelling or inflammation if there is any. And also just allowing those tissues to fully heal and recover before you're putting that excessive or extra load on them, right? So again, especially as you're working with weights, you're working with a lot more resistance and loads. That's why it's more important to allow those structures adequate time to heal and recover from the previous workout, right? So you can work out while you're sore, as long as you're warming up properly, you're doing the things that you need to do to make sure that you're preventing injury. But in terms of having pain, like sharp pains, and another great example is a lot of times people will have knee pain with squatting. Like, for example, one of the things that they'll say is, oh, I started increasing this with my squats, whether that be I started increasing how often I'm doing the squats or increasing the load that I'm not typically doing. I'm going heavier in weights with my squats multiple times a week, and now they're having knee pain, and they say that, oh, I can still perform the squats and the weights that I want to, but now the knee is hurting more and is hurting consistently. At that point, the structures around the knee, because then there's a lot of different diagnoses that it typically can be that's affecting the knee pain, but what that's telling you is some of the structures around the knee, whether that be the quadriceps tendon, whether that be some of the patellar, peripatellar structures that surround the kneecap, if there's too much load too soon on those structures, they might be causing the pain, and then in turn affecting how you contract or activate certain muscles like your quads. They can affect how your movements are in terms of the coordination or just even the mechanics. If you just have the pain or even any inflammation around the knee in general, that's going to affect how you move, right? So that's a type of pain that you want to address, and you don't want to just continue to keep working on those same lifts, the same exact weights, even though you physically can. your body's telling you that there's something that's being overloaded, whether that be the tendon, whether that be the muscle, or some of the other connective tissue around that joint. So that's something that you want to address and either bring down, like I said, the load or the frequency, and making sure that you incorporate whichever mobility, stretching, strengthening, or other modalities that you need to reduce that knee pain. So main thing is you can work out through some soreness, right? As long as you're doing that smartly. But those pains, especially if it's around tendons, around the joints, and it's very sharp type of pain, those are the pains that you want to address, and you want to back off in terms of reducing load, reducing frequency, and taking care of those structures so that you prevent any future injuries or any unnecessary injuries that you can get from just pushing through the pain, right? So it's not always no pain, no gain. It just depends on what type of pain that you have. Thanks for watching. If you found that video helpful, please subscribe to the channel, and I'll see you in the next video.